Good morning, students. Today we will discuss about the cranial venous sinuses. They are also known as cerebral venous sinuses or dural venous sinuses. So these are venous spaces situated in the cranial cavity. Sinus is basically a cavity. They are present between the endosteal and meningeal layers of the dura mater. Dura mater is the outermost meningeal layer. There are three meninges that cover the brain, that is the dura mater, the arachnoid mater and the pia mater. Dura is the outermost and that forms the walls of these venous sinuses. That is why they are known as dural venous sinuses. So you can see in the figure, this is the dura mater. The upper layer of the dura mater is the endosteal layer, which is in relation with the skull bone, and the inner layer is the meningeal layer that is related with the brain or the next meningeal layer. So these venous and you can see the blue venous spaces, these are referred to as cranial venous sinuses. They have a lining of endothelium. There are no muscles and no valves. Again the figure showing the same thing, the dura mater, the two layers of the dura mater and how the venous sinuses are located in the cranial cavity. The cranial venous sinuses receive venous blood from the brain, meninges and the bones of the skull. In certain sinuses, CSF is also poured. These venous sinuses are connected with the outside of the skull through the emissary veins. So, emissary veins connect the cranial venous sinuses to the extracranial venous system. This has an advantage and a disadvantage. The advantage is it keeps the pressure of the blood constant, and the disadvantage is any infection or any injury in the extracranial region can easily transfer to the intracranial region through these emissary veins. In this table, the various types of venous sinuses, cranial venous sinuses, have been presented. They are divided in two categories, paired and unpaired. The paired venous sinuses are cavernous sinus, the most important one, the most clinically significant one, because it has various important relationships with various arteries and nerves. So any infection that reaches the cavernous sinus can cause serious clinical manifestations. Next is superior petrosal sinus, then the inferior petrosal sinus, transverse sinus, sigmoid sinus, sphenoparietal sinus, petrosquamous sinus, middle meningeal sinus. These are the paired sinuses. The unpaired sinuses are superior sagittal sinus, inferior sagittal sinus, straight sinus, occipital sinus, anterior intercavernous sinus, posterior intercavernous sinus, basilar plexus of veins. So these are the different sinuses and they have been named according to their location. In today's lecture, we would discuss in detail about the cavernous sinuses. These are large venous spaces that are situated in the middle cranial fossa. So there are three cranial fossa: anterior, middle and posterior. In the middle cranial fossa, you have the cavernous sinuses on the right and the left side. That is on the either side of the body of the sphenoid bone. This is the sphenoid bone. These are the wings of the sphenoid bone, and this is the body. On either side of the body, there are cavernous sinuses located. The length of the sinus is about 2 centimeter and they are 1 centimeter wide. The interior of these sinuses is divided by a number of spaces or cavernas by trabeculae. Here in blue, these are the cavernous sinus. This is a coronal section. So this is showing the interior view of the sinus, and you can see the various spaces or caverns by various trabeculae. These are the spaces that you can see. The floor and the medial wall. So the lower portion, the floor and the medial wall, is formed by the endosteal layer of the dura mater, and the lateral wall and the roof is formed by the meningeal layer of the dura mater. Extension of the cavernous sinus. So it extends from the superior orbital fissure anteriorly to the apex of the petrous temporal bone. So in this figure, you can see this is the superior orbital fissure. This is the outline of the orbits. So this somewhere here is the medial end. Of course, this is the medial side. So medial end of the superior orbital fissure, and posteriorly the apex of the petrous temporal. This is the petrous temporal bone, petrous portion of the temporal bone. So the sinus extends from the superior orbital fissure anteriorly to the apex of the petrous temporal bone posteriorly. So this is about the general introduction of the cranial venous sinus and the location and extent of the the cavernous sinus. The remaining part we will cover in the next lecture. Thank you so much.